Hello, Namaskar, and welcome to Apollo 24/7's Health Hour. Health Hour brings you experts from Apollo hospitals to this live show. You can join us on the live and ask questions and queries on the YouTube chat box. You must be watching this on other platforms like social media, but if you have a question or query, may I request you to hop on to the Apollo 24/7's YouTube channel. You'll find a lot of interesting content there. You can subscribe, and there's a lot of health info on the channel. And this is a live show where you can speak to the expert as well. On the show, we do have a health quiz where you can participate and win prizes from Apollo 24/7. And also, I'm going to give away discount vouchers and coupons that you can use on Apollo 24/7. And this app brings the entire facility of Apollo hospitals to the convenience of ordering medicines, booking lab tests, and actually booking consults from the comfort of your phone. So I urge you to download Apollo 24/7 and become a circle member as well, so that you can avail all the benefits of Apollo 24/7. चलिए आज का टॉपिक हम बात करते हैं. Today we're going to have a neuro and spine surgeon on the show where we're going to talk about headaches. What are the dangerous headaches? Which are the warning signs? How do you understand and fix your headaches? A complete guide about headaches. And today's expert is with more than 20 years experience, Dr. Brahma Prasad, who's a neuro and spine surgeon from Apollo Hospital, Secunderabad, Telangana. And he can be consulted for acute and chronic headaches, migraines, cervical spondylitis, brain tumors, infections, vascular malformations, and trauma and other head injuries as well. He's a member of Neurological Society of India, North American Spine Society, World Stroke Organization, American Neurological Association, and the American Society of Interventional Pain Physicians. So let's welcome Dr. Brahma Prasad. Good morning, Dr. Garu. Welcome to the show.
Good morning, Jhansi Garu. Hi. Thanks for having me here, and welcome to all our viewers of Apollo 247. Hope they're doing good.
Thank you, Andy. Yes, we want to be free of headache. So the moment I can call myself good is the day that I don't have a headache. Headache is one of the most commonest problem that we find. I think there's one Telugu saying, I know there must be a few of our Telugu audience out there who will understand why both me and Dr. Garu can speak the language. I will. కన్నీళ్లు లేకుండా సముద్రాన్ని తలనొప్పి లేకుండా జీవితాన్ని దాటలేమంటండి.
Exactly.
I'm sorry, కన్నీళ్లు లేకుండా కాదు, కాళ్ళు తడవకుండా సముద్రాన్ని, తలనొప్పి లేకుండా జీవితాన్ని దాటలేము. That's the right word.
తలనొప్పి లేకుండా జీవితాన్ని దాటలేము. Correct.
Yes. So headache के बिना एक आदमी एक जिंदगी नहीं गुजार सकता है, not a single day. Why is it so common? Let's try to understand the simplest ones first. Why does our head ache?
Yeah, that's a very very common question for a very common condition. And like you said, Jhansi Garu, this let's suppose our world is about 8 billion population, right? And in a study it says that about 96% of the world's population has had or will have headache in their lifetime at least once. So now imagine, like, it's almost everybody, right? It doesn't spare children, young adults, or adolescents, or everybody. Yes. So now coming back to why it is so common. It could be a very common symptom of a smaller thing or nothing. Ranging from that to it could be an initial sign of something serious also. So these pain sensitive structures, they get triggered, and those triggers could be common stress or exertion, what you have in your daily life, and all those common things. So they cause trigger of these receptors, and that causes headache. So there are multitude and variety of factors. So there's no end to that. So one in sense, one that can lead to those trigger, and that can just return headache. So that's really it's so common.
Wonder, Doctor. Sorry, I always used to wonder, if I'm stressed or there's a trigger or something, why should it pain only on my head? Why is it not on my hand?
Reason. no good quality of sleep. It's advised at least you should be sleeping about 6 to 8 hours of undisturbed quality sleep you should be having. But tell me how many of us are having that 6 to 8 hours undisturbed sleep? The eye lens, what we have inside the eyeball, the focal length of it recedes as we age, and also due to multiple other conditions like diabetes, if you have, and the refractive index changes. So it's better to frequently get checked so that that strain falls onto your eye muscles again, and that can cause headache. So this is so common, right? So the sleep and the refractive errors things, and also stress. Now, because of all the change in lifestyles and pressure work, targets and software and all those industries and physical exertions, people manually work and all those fields. So that stress also is very common. So stress headache, if you believe, it's about 40% of all the headaches are due to stress headaches.
Wow.
40%.
Oh, that's a big
Yeah,
number.
staggering
It's a
number,
very big number. Yes.
right? Yeah. So these are very common things first. Properly hydrated. How many of us drink about 2.5 to 3 liters, or at least 3 liters a day, apart from what we have with our food, right? So we are
Correct.
chronically dehydrated, in fact.
Sleep, stress, vision, and hydration. You've given us
Yes,
4 points,
correct.
which are the
These are commoner
simplest
things.
reasons for the common
Yes,
reasons which can cause a headache. Now, can I
yes,
ask you one more question? Does the headache indicate, the region of the headache indicates something? I have a headache here. Somebody has a headache on the eyebrows. There are people who have headache on the temples. There are people who have only here, around the ears, around the below the ears. Is there any value to the region where the site or the site of the pain is?
yes. That's a good question. In fact, there is, the stress headache. Again, the patterns of the headache is important. Sometimes it could be, like you said, generalized headache is more common, and stress headache being the most commonest. They describe it as having a band-like sensation tight around their neck and totally head around, all around. So that's called holocranial headache, where the headache is all around the head. That is more common. But sometimes headache has a laterality to it, in the sense that the site from which it originates, makes us wonder. That has got some clinical significance to it. For example, going to the more complex ones, if you have any brain tumors or any infections or any abscesses kind of things. So that particular side, the headache is more prominent. So one side that could be clinically significant. But again, the common things when you consider laterality, it comes to migraine, which is again very common kind of headache. And migraine also contributes to about 10% of all the headaches when you consider. So that also is a staggering number. So that also has got
Right.
laterality to it. So matlab, it can originate one sided.
Correct. Correct. And sinus and other ENT issues or vision issues, they
Exactly.
also have a particular reason and a region to express.
Yes, exactly. Like you said, because we have all the sinuses, the main sinus being the frontal sinuses and maxillary sinuses and other deeper sinuses. So the common infections are usually in the frontal and maxillary sinuses. So people who have these ENT problems or asthmatics, and they're more prone to sensitivities or hypersensitive individuals. They have this chronic sinus kind of infection kind of things going on. So that can also precipitate headache, and that usually is more prominent, early in the mornings, and obviously you can locate it to the sinus regions here. So that is one thing.
Mm,
And
right.
again, like suppose we'll cover the back of the head also. People say, we have pain here in the back of the head, and that can be due to something more commonly because of cervical spondylitis, or
Mm-hmm.
even more commoner if your position is not good, sitting not your sitting positions or sleeping positions are not
Posture.
good. So posture, yeah. So these are the more common things which could have clinical significance.
Great. So now I would want to start off because I see Dasri Devi who's already posted a question. But let me start by asking age-wise headaches. You know, as a child, I used to, while I was in my classroom, We thought it was vision defect. We went to check our sight. But I used to face a lot of headaches in my childhood. And I see the youngsters now
Mhm.
also complain. So childhood headaches are common. But as I aged, I think they came down, they subsided. Is this
Yeah.
something, is this showing a pattern or something? Is this common in children?
Yeah, like nobody is, uh, you know, is immune to this headache and headache. So children also are more frequently they have this symptom. It's more commoner in them also, and usually the more common causes of headache in them are again migraine and stress headache. These are the top two in them also. And apart from other any clinically relevant secondary headaches, but otherwise these two issues again are the more common entities in them. And so you should be clinically screening for them, clinically detailed history and as to the stress they're undergoing and what is their work pattern and how their sleep is and all that. So a detailed clinical evaluation, detailed history will help. And obviously, if it is migraine, then again, what type of migraine and those issues also are helpful.
Great. So, children, when they complain of headache, I think parents should not take it easy. Maybe we should evaluate, and how sooner, and what are the first high line of evaluations that a parent's the responsibility? Where do they take them?
Yes, I mean, usually in them, refractory errors, what position they are sitting in the class, or what is the strain they are undergoing on the eyes, and if they are having any glasses, so how frequently are they requiring any change in the glasses, and regular follow-ups with an ophthalmologist, and those kinds will help because many of them have all those refractory errors is the most common thing because we all know as students, we used to run to first benches and second benches and sit and see, and sometimes people sit in the, so depending upon the position where they sit, their heights and their distances,
Correct.
their
Correct.
all those things matter. So not to take every headache lightly, but regular clinical evaluations will help.
Right. And then from the children to the young adults, I move on while not leaving the children and the young adults. The gadgets, the time that we spend on the gadgets, the sleep factor, the hydration factor that you already have mentioned. Can I add
Yeah,
the impending social media and the distractions, the gadgets and their sensory issues?
obviously, like your brain is now, working. It has to work and it has to take multiple inputs at a time. When you are addressing, when you are using all those gadgets and all those stimuli, so you are making it work a bit more harder, right? Apart from your regular things, what you run in your background, and also your when these gadgets and all. Now you must be knowing children when we are. I mean nowadays they are onto these gadgets and all, and now WHO also has described this as an addiction, right? It's an
Mm-hmm.
addiction disorder, yes. So that also is playing a major role in their behaviors as well, not just the headache. Uh, so yeah, so gadgets, that is one part. And there's a study also on mobile phones and gadgets, which recent studies where they said that people are more prone, in fact, who are more really, yeah. So who are more onto these gadgets and mobile phones, who have longer spending times on mobiles, so they are more prone to headaches. There are multiple studies which have come up recently.
We know this, Dr. Garu. It's not that we don't know. बच्चों से
Yeah,
पूछो बताएंगे, बड़ों से पूछो बताएंगे. But क्या करें? Addiction ऐसा चीज हो गया है that we are unable to get out of it. Maybe we should give enough importance to being well-being. That's when we will start
yeah,
to understand the impact.
correct,
Yeah. Here's an
correct.
interesting question that I'm seeing on my YouTube chat. Manish Sharma ji is asking this question. Pediatric headaches caused by tumors, and it is can be caused by tumors. Do you recommend or are CT scans required? I'm trying to put the place the question because it's not place the question in full. Pediatric
Yeah,
headaches due to tumors. How do you
yeah,
identify them? Is a CT scan required?
yeah. This is a good question. Actually, children, there are two kinds of tumors depending upon where they can arise. usually the larger part of the brain and the smaller brain, what we call the cerebellum. And children more specifically have this infratentorial tumors or the in the region of the brain which is in the lower side, that is the cerebellum. So they are more prone to having these seizures. And more particularly, if they have this, then usually they present with headaches and vomitings and sometimes blurriness of vision. And usually early morning vomitings is a classic sign what they have. And if any child with worsening headaches or headaches with increased repetitive frequency or severity, then definitely, I mean, he should be evaluated and taken to a specialist. So that, depending on history, maybe further workup could be done.
Great. So that, with that, I think I should start off with this serious sign. If see is headache trying to signal something serious? How do we identify that?
Yeah. I mean, generally going through the basic. If you consider like headache has certain comorbidities also associated with it, right? I mean, there's a study which has been published long back, and it says that most commonly headache is associated with other kinds of conditions like diabetes and hypertension and ischemic heart disease or stroke, and also like obesity and those things. So, addressing not just the primary headache, but also evaluation of these factors, underlying factors, also is critical for the complete management of headache. So, now coming back to your question, I mean, when does headache become serious, or when does apparently innocuous kind of a headache
Sign.
suddenly? Yes. So, what are the signs? Initially, like if suppose we have stress headaches, we are taking tablet once a day or once a week or twice a week. So if you tend to realize that the frequency of headaches has increased, maybe once more than once a week, or the tablets whatever you're taking, let's suppose you're taking a small crocin or naproxen. So if the frequency of the tablet increases, maybe twice or thrice a week, right? Or there is a change to the pattern of your headache. Let's suppose it was initially only one-sided, now it has become whole. It has spread to the other parts of the brain as well. Or there are certain other characters to it, like any visual disturbances or any nausea or any kind of vomitings, all those, or any visual blurring and all that. So, any associated other new symptoms, worsening of your headache, definitely these are the things which needs to be seriously looked at, and
Okay.
evaluation is further necessary. Yeah,
Right. So here's Dasri David's question regarding stroke that I would want to ask first about stroke.
yeah,
Is there any type of headache, or can you please identify a kind of headache which can warn of a stroke or an impending stroke?
yes. So basically, when we are talking in terms of stroke, there could be two kinds of stroke. First could be an ischemic stroke, where that is the more common thing in about 80% of the cases of the stroke. It is ischemic stroke, and that is when we call that when the blood vessel carrying blood to the particular part of a brain, when it is getting compromised, the blood supply is reduced. Then we have a stroke. That is called ischemic stroke, right? So that is more commoner. But the more sinister one is the other kind of stroke, which is called hemorrhagic stroke, and that usually
Correct.
happens
Correct.
when this blood vessel ruptures and the blood accumulates there. So that is more serious one and the less commoner one also. So in those some circumstances where you have this severity of headache with associated any change in any your normal the way you speak, or associated with any giddiness or any other signs of any vertigo, yeah, and any other numbness of your hands or legs, numbness of your feet, or your inability to talk, dysarthria, what we call. So if
How
these
long would these
features are
be,
present,
Dr. Garu? Will these be present a day or two, or is there that much of time, or is it a sudden onset? And I understand that the first few golden hour rule, whatever applies. How long will
yeah.
I be warned before this?
No, there is no. Unfortunately, there's no particular hard and fast rule in this case. But there are certain entities where, let's suppose you have a subarachnoid hemorrhage. That is one kind of hemorrhagic stroke where there is a small weakening of the blood vessel and which balloons out like a balloon and it pops out, right? And that can suddenly worsen your situation and people can go into coma in such cases.
So you don't
But
have time there.
fortunately, you don't have time there. But fortunately, in some situations, what happens is this balloon tends to leak some fluid out of it slowly, slowly. That is called sentinel headache, maybe 1 2 days prior to the actual event. So that is when you should be able to pick it up.
Hmm. Because I had one of my pedama who complained of this headache, and then we realized that she has had a stroke, and then she was rushed. So,
Oh,
so I that's the reason why I was asking. She did not even tell us that she was going through, kind of headache and blurriness. She couldn't
exactly.
identify. She thought it was quite normal.
Yeah. So headache doesn't necessarily is not a symptom for stroke, and only in certain kinds of hemorrhagic stroke, probably subarachnoid hemorrhage, like I told you, or any vascular malformations. Before the bleed occurs, there could be some clinical indications, but usually people don't tend to take it seriously because it occurs like a small headache,
Okay. Like,
and they tend to,
yeah.
yeah,
So, and also hypertension. Mr. Nasiri David, if I remember, is a 66-year-old male with diabetes under control, with hypertension also under control. I would want to ask on behalf of him, because he keeps asking about hypertension being under control. Does it hold some kind of harm, even if it is under control? You knowing that you have hypertensive nature, does one have to be extra cautious with headaches?
absolutely. Because now, see, hypertension is there, so it is there for life, right? So it is under control, but it is there for life once you have it. So all the things, the diet, what you take, right? The sleep pattern, what you have, the mental relaxation, the state of mind, what you're at. So all these factors play a role. So it's a dynamic situation, right? Not a situation is similar. There could be ups and downs in any of the multitude of factors. So they can trigger. Like suppose you have had some high pickle on that day, right? So obviously there's more salt to it. So probably that might have shot up your BP from a baseline
Correct.
to a higher level. So that is when we call it as labile hypertension or accelerated hypertension. So that can again cause headache. So having BP, but keeping it under control is very important, and being cognizant of all these factors which can bring it up and down. That also awareness is very important.
Yes, yes. So yes, while asking about hypertension, आपने जैसे कहा था कि if you have vision problems every 6 7 months, that please go get yourself checked for your refractive errors. Hypertension, I think, also requires to be monitored all the time.
Definitely, yeah. And there are two things to it. Like if you are trained to get yourself checked with your regular machine at home, that is fine. But again, for beginners and who don't have the proper know-how how to do it, then it becomes a problem because placement of correct batteries and placing it right and all that is those are very important factors.
So
So
there is
doing it
always
the
a
right way is
primary
important.
healthcare.
Yeah,
Right?
exactly.
Yes. Thanks, David Garu. We always appreciate and value our audience who join us regularly and make this show really very interesting. Thanks once again. Well, here's Naveen Bhatt's question. Naveen Bhatt is looking for help here. Uh, Naveen Bhatt has headache on forehead and all sides as well, at the back of the head since last 15 days, and he is not able to sleep well. He is in Mumbai and he would want to contact somebody in Apollo Navi Mumbai or Borivali, but Apollo 27, Apollo 24/7 also you can consult Dr. Brahma Prasad. That will be easy for you, and then we can put you to the nearest hospital in case you require a physical checkup as well. So, Dr. Brahma Prasad ji, here's Naveen's question. 15 days से है इनको सर दर्द, forehead and all around the side of it. What do you think is the reason? Would you want any other further details for him, from him?
Yes, ma'am. Like, if this headache is in this episode, what he's stated, whether it is a singular episode or whether he has had these episodes before, also is one important thing. And 15 days continuous headache, whether what is the pattern to it, whether it is static or it is coming and going down or it's progressively increasing, that also is important. But going by 15 days continuous, probably should be stress headache. But again, a detailed history would be helpful. And like you said, if you can call anybody up or on 24 by 7, we are available so that a detailed clinical history is elucidated.
करेक्ट करेक्ट। तो नवीन जी, एक काम कीजिए, आप जो डॉक्टर साहब ने आपको बताया है अभी आप टाइप करना चाहते हो, तो आई विल टेक योर क्वेरी अप इन अ शॉर्ट व्हाइल। आई विल वेट फॉर your details. Next question is Venugopalan Thambi. Yes, I was expecting a migraine question to come in. Here's Venugopal's question. I'm having migraines since last 15 years and I've tried all sorts of medications. Topamag, Diva, OD, Notima, and all beta blockers, etc. And even the painkiller. The painkiller that gives me relief is headset. So he's
Yeah.
asking, unfortunately, medicine overuse and headache is also there. Do you recommend the injections which were suggested by a doctor for this?
Yes. Going by Naveen's question, this thing, I think this is Naveen, right?
Venugopalan Thambi.
Venugopal
No,
Garu. Yeah.
Venugopalan Thambi.
Okay. So going by
And
his
yeah,
query,
yeah,
it
he's added
seems.
one more bit of detail. Dr. Garu, can I add one more detail from him?
Yeah, yeah, please.
Here's one more additional. My headaches is on left forehead today. The next day it's on the other side. If I take pain medicine in the evening, the next day I get headache on the similar timing, and I have anxiety as well.
Yeah. So any other comorbidities in him, like diabetes and hypertension, other things apart from this?
I will wait. I will wait for him to type. Mr. Venugopalan, can you please type your other comorbidities as well? Yeah. And he's talking about the injection Suvire.
Yeah. So, going by his history, it seems that it's a recalcitrant or resistant migraine. In those cases, generally, after trying all kinds of categories of medications and prophylactics and various different combinations, if it doesn't work out, generally, yeah, injections are tried, and
He
sometimes
doesn't have any other
Botox also helps.
comorbidities, doctor. He doesn't have
Okay,
any other
yeah,
comorbidities.
okay. So, has he tried this Botox injection any time? No.
We'll wait. We will wait for the answer. It's what's the Suvire injection, doctor?
This is what we give when all the other types of modalities are exhausted. It's a combination. All the other prophylactics and abortives medications. What we do. There is one thing to it. Generally, what happens is if you keep on using, there's a study which says if you keep on using all this medications for painkillers frequently, the frequent the use, there are certain areas of your brain where the flow of information for this pain occurs, the thalamus. So those areas are affected, and when it comes to actual medications, they decrease the effectiveness of these medications, prophylactics. So the overuse of painkillers also will not help you at the end of it.
Correct. Correct. Yes. So anxiety and stress, are these caused by the migraine which is not under control, or do you think the anxiety and stress is the trigger for the migraine?
Yeah, it's the other way around, like you said, the second half. Anxieties and they could be trigger for migraines, and they
Okay.
are part of it.
Uh,
Usually, people who have migraines also have anxieties.
I'm not sure if he's tried Botox because he's not yet typed the answer yet. But so the injections, yeah, no Botox, no, not Botox. Heard negative things about it. So tensed Suvire is also not. I'm not sure. That's why I'm asking for your advice.
Yeah, I mean, if he's following up with a clinician there, I think you can. It's worth a try because he's tried all. By understanding by his messages, we seen that he's exhausted all his options there. So at the end of the day, like IV medications and injections work, and sometimes help us in getting a rest phase where we can start re-begin with again other medication, other category of medications. So probably he'll be a good
So
candidate for trying these medications. Yeah,
it is
advice to
important to give
meet.
a rest phase. Yeah.
Yes, yes.
Correct. So I think you should try it out, and with the right guidance, Apollo is always there to support you, Mr. Venugopalan. So here's Naveen's addition to his question. He has his headache continuously, it doesn't give him a break.
Yeah, so that is when IV medications help. The injections, there are certain category of injections which are given IV as well these days. So they can help him, pull out of the pain cycle and then probably give him a break and then re rejig all his medications, what categories of medications he was previously taking, and what combinations of or classes he was having. So I think IV medications first, and then probably reassessment of all his previous medications would be ideal in this case.
All right. So that is Naveen's answer. I think you got the answer, Naveen. You have to consult your physician, assess what your headache is, start taking medications. If they are not, please reassess, and then take an IV medication if it's not fixed by the oral medication. That's Dr. Brahma Prasad's
Yeah,
answer for you. Can I continue with the migraine questions, Doctor? I think most of us would want to understand, especially Ruchika, who's been asking us to give an understanding of migraine quickly.
yeah,
How do you, diagnose or misdiagnose migraine? Can you please give us an understanding of migraine first?
yeah. So of course. So migraine is like we understand it is one of the more common causes of primary headaches, primary headache disorders, what we call. And there is no particular medical condition underlying to it which causes migraine. And usually, migraine is a disease you diagnose it by exclusion at the end of it. If it is not this, if it is not that, if it is not that, then it would be migraine. So likewise, like you diagnose migraine based on exclusion of all other major serious illnesses. But all said, again, migraine is very common. So affecting about 10% of the entire population. So the basic, if you consider the basic, the pathophysiology of it, how it begins, like so, there are certain substances in foods or chemicals and other things. In particular, individuals whose body is the receptors are very much sensitive to histamine and other kind of vasoactive amines, what we call. And there is this constriction and dilation of vessels which happens in their brain, and that causes migraine. Uh, to begin with, this could be in smaller episodes, simpler episodes, but sometimes they prolong. And usually, this migraine also has what is called as aura. In the sense, there could be some premonitory symptoms, like there could be some flashing of lights and some funny sensation in your tummy, some vomiting sensation, nausea kind of things, which is called classic migraine. And other kinds of migraine also, like there are about 13 different types of migraine, but these are more commoner. So
And
usually
how do
the
we
pattern,
treat?
how,
How?
yeah.
Yeah, once we understand and identify a migraine, how do we start to treat it?
Yes. So usually what happens is, like, initially if the frequency is, let's suppose, more than once a week or twice a week, and it's more disabling, it's not allowing you to work your daily life, and it's becoming a bothersome thing, then you start on what are called as migraine prophylactics. So different category of drugs, they're called abortives. Those are when you take as and when required, when you have headache, when you have that migraine episode, like the other gentleman just now said, headset. So there are certain categories of drugs which work then and there. Like when you have headache, you take this medicine, usually triptans, category of drugs which help, and they relieve the headache at that point in time. And other painkillers also, over-the-counter medications, where there are certain other categories like crocin and simple naproxen and other NSAIDs which can help. If it's becoming more bothersome, then you have other categories where you put the patients on for quite some time. Maybe, initially to begin with, it's about 2 months, 6 to 8 weeks. And usually we begin with a single drug and see whether, the symptoms are relieved, or else you add one more
Yeah.
drug. And then you wait for about 6 months to 1 year time period until the
Hmm.
symptoms are under control. Once the symptoms are controlled, then you slowly again get them down to the you taper them off. So it's not like you put them and the for the effect to begin also there should be about 6 to 8 weeks of time. So it's not like you've taken the medication, it's not working the other day. No. So you should give it time also. Let's about 6 weeks to 8 weeks. And withdrawal also should be like gradual.
Okay. Okay. So now I understand that it is not a simple procedure and we all have to follow,
Yeah,
rule out and then add and then remove and then see. It's
exactly.
not just I go to a doctor, I get my prescription and I'm fine. This is a
Yeah,
condition that is going to require a lot of attention. So your doctor and you have to
yeah,
be together in this. Yeah. So here's
exactly,
Praveen
exactly.
who's continuing. Yes, doctor. Praveen's question, could I take? Here's Praveen.
Yes,
Doctor,
yes,
for the
please go ahead.
past few years, I get headaches once every month, especially if I'm exposed to the sun for more than an hour or when I drive car long distance during mornings, that is again sun. It gets relieved with 500 mg of paracetamol intake. Is it due to migraine? Should I be worried about it?
Once in a month, I would not be concerned. That is not that is not looking so serious thing. Once in a month, that is very common to have once in a month. But if the frequency is increasing, it's more than once a week now. It was once in a month, but the frequency is increasing or the severity is increasing. The duration of it is increasing. Then probably I'll be concerned and start medications. But once in a month, I will not recommend him anything apart from putting some window shades or avoiding suns in the early morning. That should be enough.
Right. So does that not come under the category of a migraine or the photosensitivity headaches? The migraine also can be triggered by sun or the light that you actually said earlier. So will it
Yes,
not fall into that category?
it depends. It could be, but again, symptoms stay how long? Whether every time sun exposure causes him headache, because daily he should be exposed to sun, right? So it's not like you are exposed for
Correct.
29 days and just 30th day it triggers. No, if it is photosensitive, then
Okay.
obviously frequency should have been more.
Okay, but there is every chance that a migraine can be triggered by a sun, and it could be a daily thing.
Yes.
Because I know one of my help who comes, she covers herself, especially traveling in a bus in sun.
Okay.
She has to cover herself, wear dark glasses, and come. So initially, one episode that we had done 2 3 years ago, I've heard this
Uh-huh.
tip from one of our experts, and I told her, "जो भी हंसता है हंसने दो यार, तुझे headache होता है daily. Why do you want to take it? चलो चश्मे पहनो, be that cool auntie in the bus and come."
Yeah, it's also a wonderful tip, but people generally have this, migraines. Unfortunately, they have this photosensitivity thing and bright lights. That's why generally we tell them to avoid bright lights. And even if professionals who are working on systems, we ask them to put a screen guard so that to cut down the bright light effects.
Like,
Or
हाँ.
yes, exactly. Or you put an anti-glare coating on your lenses or spectacles so that to avoid that bright thing sensitizing your headache, acting as a trigger.
Hmm. So yes, in Praveen's case, he is taking a 500 mg paracetamol. Now let me come to the common fixes that we all do to reduce our headaches. Pop in a pill,
Yeah,
apply something, or have an eye mask and sleep. All three together
yeah,
also are being done. So
common
the,
things
the,
done.
the
Yeah.
common intake of paracetamols or any other pain relievers, how good are they? Are they causing me some kind of damage in the long run? What is the judicial use of this?
I would say, like, in situations where you could not avoid uh, having this headache, or you are having a headache and you have to, get rid out of it, then obviously starting with a low dose painkiller is advised, maybe once, that's all. And you can do your favor by, taking potential hard, I mean, potent medications which are addictive ones, and also not going for higher strengths, because people sometimes might have other conditions like maybe peptic ulcer or acidity kind of things, where taking these medications might be more harmful than doing good. and should very cautious about taking our higher dosages. And then uh, we are talking about the
The painkillers, doctor. So while we talk about
yeah,
painkillers, you're mentioning that you should be aware of what kind of harm it can do in a long run, right? So
yes,
what are the
yes, yes.
safest ones, and how long can I take it safely?
No, I mean, all painkillers, I mean, all said and done, they have their own adverse effects in the long run, though not in the short term. They have their adverse effects in the long run. So it's better to avoid them altogether if you cannot. If you could, you can avoid them. But if it's necessary, once, like I said, a small doses of medications in the beginnings should be enough. But if the frequency is increasing and you have to take more than once a week, or like I said, the dosage needs to be increased more than twice or thrice a week, then obviously you should be consulting a physician so that you can go for a prophylactic kind of a medication, where these
Yeah.
are medications which reduce your frequency and intensity of the episodes.
So this was one big joke between me and my. It's not a joke. It's a tip, but that runs between me and my friend circle. The moment one of us, all three of us, between three of us, if
Yeah,
one of us complains that I'm having a headache, then we see that we're not reaching out for a tablet, but immediately one gives a bottle of water and says, "Go sleep." How it's that's how we manage keeping us checking the factors of dehydration and lack of sleep. Would you advise the same?
correct. Obviously, these are very important. Like we talked in the beginning, maintaining a proper 6 to 8 hour quality sleep is very important because there are certain triggers called as migraine triggers, under which less sleep also is a trigger. And so 6 to 8 hours of quality sleep, undisturbed sleep is very important. And having a proper food is very important. At times, again, is important. Balanced food, and usually about the recommendations nowadays are about 70 grams of protein a day at least, so that it stabilizes your glucose metabolism. That is very important.
70.
And again,
Did I hear it right?
70 grams
70
y-
of protein.
grams of
Whatever
protein.
weight
Yeah,
that I
yeah. I mean, again, weight for height and all those measures need to be taken in, factor in. But on average BMI, 70 grams of protein is very good because they actually tend to stabilize your blood sugars. That is one thing.
okay.
And basic regular aerobic exercises, maybe 30 minutes workout thrice a week, should be very helpful because the body, when you exercise, what happens is it releases certain chemicals, right? So called endorphins. So they block the pain impulses to the brain. So they are good chemicals to receive. So likewise, and lifestyle changes and these modifications should be helpful.
Great. Thank you so much. I'm sure I'm smiling because my friend has texted me saying that, did you hear 6 hours is enough? Don't push me to sleep for 8 hours. So
Yeah, 6 hours if you're having really good quality, that should be enough.
yes, 6 hours of good quality, not waking up in between and not having a disturbed sleep is very important, right?
Correct.
Anmol Ratan Singh's question comes next. Does taking deep breath help to naturally recover from headaches immediately?
Uh, yeah, I mean that is also a known thing, but usually we don't suggest that. Deep breathing exercise are I mean they are advised as prophylactics. They also are a part of that exercises and all those lifestyle changes. They really help. Deep breathing exercises
Right.
are helpful, but again they should be monitored by professionals, and supervision is recommended.
Great. And now after the painkillers, I have asked you about the topical applications that we have as painkillers. It could be as simple as inhaling something that tingles you or has menthol in it. How does that
Yeah.
help me relieve a headache? I'm always surprised with that.
Yeah, I mean, topical things are what you give on your skin so that they penetrate inside. There's transcutaneous penetration, what we call. They also have their effect in, helping those receptors which are present in there, so that to stop the pain impulses traveling deeper into the other areas of the brain. But in there are certain oils like lavender oil and like you said this menthol oil also. They also can help you get down this migraine. So any forms like inhalation form or even the smell of it sometimes could
They can
relieve that.
trigger, you mean to say?
No, they will relieve the
Oh, they
episodes.
relieve. Okay, okay.
Yeah,
They can relieve potentially some
they
kind of
can relieve
herbs.
you. In the long run also, they people usually carry them also. Like if you see some of them,
I always felt, Dr. Garu, something like the balms that you apply, all these the
correct.
names that we have outside there, all these balms, I thought they create a sensation around that local area. Thereby, my brain is perceiving that this is relief. Is it true, or am I being? Is it really relieving me, or am I being what do you call cheated or fooled?
Yeah, I mean that is basically if you get into the intrinsic actual concept of it is called as gate control theory. You're talking about. So gate control theory is where the concept of acupuncture and all the work. When you insert needles at certain points, what they do is they block the impulses, actual pain impulses which go to the brain, and your brain is tricked or kind of fooled to think that it's coming from that side and it blocks. So those kind of mechanisms work, but they are for localized other kinds of pain, not migraine or uh, other kinds of headache. Some headaches,
Mm.
yeah, they might work,
Mm.
but not all.
Yeah. So here's Praveen, who's written back to us the monthly headache while driving, while sun exposure to
Hmm?
light. He's written back to us. Thank you, doctor, for your advice. To add to my question, my monthly headaches frequency or severity is not worsening for the last 8 years.
Okay.
So what can he do now? It isn't worsening, but it is there.
Probably, putting on shades while driving, that should be helpful.
Hmm.
Because if the symptoms are only once in a month and not so severe, I would recommend him to just put on some shades while driving. That should be enough.
All right. So Prithvi's question is next. Can sinusitis cause headache?
Yes, sinusitis can cause because, I mean, we have also discussed, I think, just some while back, because sinuses are structures which are very closely related to your brain and they are in the head. So, any infections or inflammations of the sinuses also can cause you headache.
Mm-hmm,
So
mm-hmm.
so frequently they need to be checked up and probably some antibiotic medications and cleaning of the sinuses is recommended if you have that.
Great. Now I'm coming back to identifying the serious factors. We've talked about migraine, we've talked about headaches, which can be stress or anxiety related, or any other vision or refractive issues related. Now, can I come back to something which is very serious? What are these
Yeah.
headaches? Who can have them? Any other comorbidities to exist with? How can I understand what is a serious headache and what is it trying to hint at?
Yes. So headaches which are usually associated with any fever or any associated any rash, especially in children, and if they have any neck stiffness, probably then that is something of concern. Could be meningitis, so that should be looked upon. And if you have a fall, if you have had a fall recently, and then you are having any headaches, then that should be of some concern post any trauma or any accidents. And especially headaches which have any nausea associated with any vomitings and any visual symptoms, any blurring of vision you're having, or any numbness or any loss of power or any sensation, abnormal sensations of your hands and feet, and any mental confusions. You're not able to, you're not coherent, you're not cohesive in your speech, and any seizures, headache with any associated seizures also. So these are all the clinical things which should be taken seriously and immediately should be taken to a specialist
Yes,
to work them
I
up
do
further.
also know a child who gets seizures, and then the episodes of headache before the seizures as a child is growing up. the child could identify that they had headaches. So seizures and headache, are they also one kind of combination, or identifying that an episode of seizures is going to come
No, headache can occur after seizure
after
because
seizure?
it's after seizures, and headache associated with seizures, which comes before, again, they fall into a different category, probably some tumors, which could cause headache and then precipitate a seizure. But both ways is possible. If you have a seizure activity also because of the large electrical impulses which burst through all your cells and which goes on, so that exhaustion also will create headache.
Correct. So these are the most serious types, and which can be, a threat to life as well, and need immediate
Yes.
medical attention and constant management.
Yeah.
Here's next
Absolutely.
question, Dr. Garu. Gautam Chatterjee is the next. That's his next question. I get headaches on and off, but many a time it could be due to an acidity. But I'm not still sure the reason for my headaches. Which specialization of doctor should I be consulting? This is also an interesting question because headache, we don't even know where to go
Yeah.
and ask who.
Correct. So that is when the associated factors become important. Now Gautam
Correct.
has clearly stated that he has this acidity kind of thing, or acid brush and water brush which comes. So probably he should be first consulting a physician, probably a gastroenterologist, to look for any acid peptic disorders and heartburn, severe kind of as hyperacidities and all that. So that also could be one reason for a referred headache. So yeah,
So, because Gautam, you do have one such, understanding that it could be because of acidity. Rule it out with gastro, and then come to somebody who do you. But generally speaking, Dr. Garu, who do you think should be consulted first?
a physician should be helpful, general physician initially to begin with.
Mm-hmm.
He should be enough. Yeah.
All
And
right.
then if at all it comes to more specifics, then evaluation by a medical gastroenterologist would be
Yeah,
better.
that is in his case. But in general headaches, also a
Yeah.
physician evaluation, and then to either a neurologist or
A
any
neuro,
other
yeah.
or an
Yes,
ophthalmologist
yes.
or any other issues. Right.
Correct.
And one, it might sound silly, but I know my trigger for headache, hunger.
Yeah.
I I get my headaches if I'm hungry, and I get
Yeah.
hungry.
Yeah. So hunger also is one, trigger for headache as well as migraine. So, because brain is supposed to be the most avid organ which consumes glucose in our body, all said apart from other organs. So it's vital to maintain that glucose level. That's why body is intrinsically built with that mechanism. So if your brain feels it doesn't have any glucose, you cause this hunger happens and it causes headache. So it's important. That's why that you maintain the timely food intake is very important
Great.
to maintain
Today,
those
all my
glucose
friends
levels.
are having fun at my cost, saying that eat well, sleep well. That's my my best friend's message on my phone currently. Great. So, Dr. Brahma Prasad, I think with that I will come to an end with a question answer session. Thank you so much for
Yeah,
being patient with all our viewers' questions. I know you are a neuro and spine surgeon who deals with more complicated kinds of headaches, but I would want you
yeah.
to give simplified tips for me to manage the headaches, please. Top tips from you.
Yeah. I mean, to begin with, though headaches are very common, don't neglect headache, right? And proper lifestyle changes, and yeah, eat eat on timely and eat balanced food, regular exercise. This should be enough to keep you, long way away from many medical conditions and disorders. Stay healthy and stay safe.
Wow, that was simple and sweet tip, but I cannot leave you right now because I have two more questions which have popped up after I said I'm going to conclude my questions. I think it's important for me to
Yeah,
take
yeah.
these
Please go
two
ahead.
questions. If you please give me a minute of time more. Yeah, here's Manish Sharma who's asking if there's a patient with head injury, does the headache mean a serious condition? Does it require admission and further evaluation?
Yes, I mean, again, clinical evaluation is key here, and the mechanism of injury, if it's a high impact trauma or what kind of a head injury it was, and depending on its clinical status, if further evaluation with a CT scan of the head or MRI brain, as required would be advisable in that case, because there are certain other major things which needs to be ruled out, like any extradural hemorrhages and all those brain injuries, contusions, and all that. So it's important to be clinically
Yeah.
evaluated.
Right. And last question, Harun Riaz had traveled to Agra 400 kilometers and on the return journey, driving the car on the Yamuna Expressway, 4 a.m., I have had severe headache following by vomiting. I am now feeling better. Can this be classified as migraine?
Uh, Probably the pollution could be attributed. I don't know, Delhi, Agra, but thing is, if this is an isolated episode, single episode, I would not call that migraine. Whether he has had similar such episodes in the past, that would be important again in the history. Any other usually what is his tendency to have headaches, and that forms a key here. So if you could tell something more about it, then it will be helpful.
Definitely. I think he'll find answers in our chat. Harunji, I request you to join us next week where we are talking about AQI, and also check Dr. Brahma Prasad's tips in the beginning of the episode, how to identify these headache episodes. That will be helpful, and the recording will be available on the channel anyway. Yeah. So thank you so much. It was so much fun talking to you, Dr. Brahma Prasadji.
Yeah, thank you, Jhansi Garu, and thanks for having me here.
Thank you once again. Have a great Sunday ahead. And I now take
Thank you,
leave
Jhansi
from
Garu.
Dr. Brahma. Yes. And I'm continuing to do the health quiz. Health quiz coming up. Here are the 3 questions I'm going to ask you. You have to answer them on the YouTube chat. Winner's name will be selected and announced towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/17. And if I take your name, you know that you have to write back to us with all your contact details before Wednesday of every week to marketing@apollo247.org. If vouchers will be shared with you. Here are the 3 questions for this week. The first question on your screen. First question is a fill in the blank question. Dash. M से शुरू होता है dash. M blank G blank A blank then N blank E is a severe throbbing pain, often accompanied by nausea and vomiting. This is a kind of headache. What is it called? It starts with M. Fill in the blanks to get the word. Question number 2. Drinking of plenty of water can prevent headaches. True or false? Drinking plenty of water can help prevent headaches. True or false? Bright lights and loud noises can worsen headaches. Myth or fact? Question number 3. Bright lights and loud noises can worsen headaches. Myth or fact? These are the 3 questions. You do answer them on the YouTube chat, and I'm waiting for your answers. And I see our regulars are participating along with our new participants. I'm waiting for your answers. Here are the coupons that you can use on Apollo 24/7. The first one that you can use is code ASKDOC150, AskDoc 150. Consult top doctors direct from Apollo with 150 rupees cash back on online doctor consultation. And the next one that we are giving away today for you is FIRST3, FIRST3. Use this code to order medicine direct from Apollo and get 25% off on online medicine orders. And you get a 2-hour delivery in certain cities. And of course, other cities, you have an instant delivery with 19 minutes delivery as well. Order and you get your medicines like that under 19 minutes as well. The next one is exclusively for our Health Hour viewers. You get 199 off on online consultations with Apollo doctors and 20% off on medicine orders when you use this code HH247. This is in gratitude to our Health Hour viewers who have Apollo 24/7 and can use it once they download the app. And next week, by the way, WhatsApp पे भी आप Apollo 24/7 के medicines and black tests book कर सकते हो. You can call or text on WhatsApp 9355247247. That's the number to avail healthcare services. Next week, we are talking about something very, very important. Delhi and Mumbai, people, you are struggling with bad air quality index. जैसे हरुण व्यास जी ने आज बताया हमको कि यमुना एक्सप्रेसवे में ड्राइव करते उनको सर दर्द आया है. आज सुबह हम लोग हमारे दिल्ली वाले दोस्तों से बात कर रहे थे to have understand that smog is a real thing there. You are surviving something which is serious. So let's understand what you have to do while surviving bad AQI, how to stay safe. This is on November 24th, 11 a.m. Do join us to understand surviving this winter with bad air quality. Okay, and I am looking out for our winners this week. Let's see, the winners are Teji, Karu Kumar, and T. Praveen. Teji, Karu Kumar, and Praveen T. Please go ahead and write back to us at marketing@apollo247.org with all your details before Wednesday and claim your prizes. Thank you so much, all of you, for joining and making this a wonderful and interesting episode. Namaskar.